everyone, it's Renee Simons from Spectrum Massage Therapy. Today I wanted to share with you something called the basic exercise. This exercise comes from the work of Stephen Porges and his polyvagal theory and has been adapted from Stanley Rosenberg's work. He is a rolfer and a craniosacral therapist. So the whole premise of working with the basic exercise is to work with your autonomic nervous system, the portion of your nervous system that is our safe, rest, digest, relaxation state, as opposed to being in what we most commonly know as our fight, flight, freeze, okay, our sympathetic portion of the nervous system. So this exercise works with the pathway of cranial nerves, your vagus nerve in particular, so a nerve that comes directly from your brain and brain stem. And we use eye movements and body positioning to put a little bit of stretch or tension on these tissues to help put good stimulus and input into your nervous system and hopefully over time affect positive changes in our body. So why would we do the basic exercise? Who would need it? If you deal with headaches, neck and shoulder tension, migraines, digestive upset, just overall chronic pain, anxiety, mood, dysregulation, this exercise can be of benefit to you. So I'm going to talk a little bit about some of the positioning and the cueing first, and then we'll go through the exercise together. So the exercise will be done seated, or you can do it laying down. Initially, I like to take stock. What is my general sense of feeling in my body to start with? So for me, I like to rotate side to side and just get a sense of how does my neck and shoulders feel? Do I have any tension or discomfort? Is it easier to go one way or the other? So this gives me something to compare to when I'm done. Next, I'm going to place my hands behind my head. Okay, so again, this is going to be placing on the back of your skull, not on your lower neck, okay? If you're laying down, you can clasp your hands behind your head or just simply let your head rest on the surface you're laying on, okay? So from there, we're going to work with some eye position. And what I'm looking for is a change in my breathing, or if I get some sort of reaction. So that reaction can show and present as swallowing, coughing, holding my breath, taking a big breath in. Everyone will respond a little bit differently, and in both directions, you may have a different response, and that's okay. If you don't get a response after 30 seconds to a minute, then we'll just have you shift into the next eye position and move on. Okay, so to start, nice and relaxed, okay, and I'm just going to look to the right with my eyes only. I'm not rotating my neck, I'm just looking to the right. And then I'm waiting for a change. For me, it makes me yawn. Immediately after, I will then shift my gaze to the left. I'm not straining, I'm just looking to the left as I can comfortably. And again, there's my yawn response. And that completes the exercise. It's that simple. So I'll recheck and just see, how does my neck and shoulders feel in relation to how it started with? If I was feeling a little anxious, or if I had a headache or jaw pain, ringing in my ears, anything like that, has that changed in intensity? Over time, I would also be aware of frequency. Is the frequency of how often I'm having those symptoms changing for me? So it's pretty simple. It can be done anywhere. So it's something that I like to recommend to do in the beginning, once in the morning and before you go to bed. And if there's a part of your day where you're struggling with some of your symptoms, give this a try. And hopefully you notice some changes. We'd love to hear from you. If you have any experiences with this, leave your comments below and let us know how you do with this.